Hey, what's up guys, it's Jin here, and in today's video we're going to talk about what happens after a rotator cuff repair surgery and what physical therapy and rehab timeline looks like following your rotator cuff repair surgery. This video and these slides are based on the article, Rehabilitation Management of Rotator Cuff Injuries in Master Athlete, and I will copy and paste the link to this article in the description down below. So here we go. So this is a general timeline here. There's 4 stages to this. There's the acute phase, the recovery phase, the functional phase, and return to sports. And what I plan on doing in this video is diving deep into each phase of rehab here. You can see that the acute phase is the first 6 weeks following the surgery. The recovery phase is weeks 6 to 12. The functional phase is week 12 and beyond. And then finally, there's the return to sports, which is dedicated solely to the functions that you need to participate in your sports again. And we'll go over everything here. So first of all, we need to know what kind of surgery you had and whether you're the right person to be watching this video, right? And so there's mainly 3 different kinds of surgeries when it comes to talking about rotator cuff surgeries. And so the first one that you see here is the subacromial decompression surgery. It's usually done with arthroscopy, and what this essentially is when you see no progression in PT or non-surgical rehab, and it's primarily because of the impingement that's going on in the subacromial space, right below the acromion. What tends to happen is because of the impingement, and the impingement is structural, right? It's a lot of structures that go on top of each other in that little space called the subacromial space. And so you don't see any progression in rehab, and the tendon's already inflamed. And if there's a lot of friction that happens in this space, you may want to go ahead and get the surgery, the subacromial decompression, where they shave that little bit of acromion at the bottom, and so you have a little more space to work with. And then the next surgery here is the rotator cuff repair surgery, and this is essentially suturing that tendon back up. And this is what we'll be talking about today, and how you're going to recover from this surgery here, the rotator cuff repair surgery. And then the third kind of surgery here is the tendon transfer surgery. And before we go into the third one, actually, rotator cuff repair, this is usually done for younger athletes that doesn't respond very well to physical therapy because of the location of the tear, because of the severity of the tear. And so, well, we've done PT for a couple of weeks now. We were hoping that the strength would come back to where it was before, and the pain would be minimized. It doesn't seem like it's happening, and so let's go ahead and take that approach where we go in there, suture it back up. The return to timeline with this surgery versus not getting the surgery at all, of course, is going to be much longer, because the rehab, as you saw in the first slide, is going to be longer, but at least we'll know that it's sutured back up. So that's usually who gets the rotator cuff repair surgery. And then the third type of surgery here is the tendon transfer surgery. This is more for chronic, bigger rotator cuff tears. And so what's happening here is you're transferring the tendon from another part of your body so that you can use it as your rotator cuff muscle. This isn't very common with the population that I treat in my clinic, but it's another kind of surgery. So again, like I said, it's that second type of surgery, rotator cuff repair surgery, that we'll be talking about today. So here's the first phase of rehab, the acute phase, which is the first 6 weeks, like I talked about. Let's pay attention to this chart here first. The goal here from weeks 0, so right after you get the surgery, to week 6 is to reduce pain and inflammation. We want to continue to protect the repaired rotator cuff muscle because it's still healing. But we also want to prevent stiffness, right? We want to move that shoulder as much as we can while protecting that rotator cuff muscle. And so doing things like scapular stabilizing muscle activation exercise might come in handy. And then looking at the rehabilitation strategies, you have to have your shoulder immobilized strictly or under strict conditions for the first 2 weeks. So immobilizing the shoulder, and then even up to 6 weeks, you may still be using a sling or abduction brace, as you can see in this picture here. She has the abduction brace, and then she also has the sling to keep that shoulder in place, because we want to try to minimize damage. We want that healing to happen as fast as possible. So using physical modalities, I'm going through the rehabilitation strategies here, using medications, but also starting that passive range of motion exercise around week 2 to decrease the stiffness as much as we can. We don't want any big scar tissues to heal or to form around that joint that could jeopardize a rehab. And doing things like scapular stabilization, isometric exercises, while trying to avoid the rotator cuff activation is going to be important here. So here are some things to note for the acute phase. You can see the pendulum exercise where she has her hand and her arm just swinging with gravity. And like I said, this is to decrease the stiffness as much as possible. We also have that passive flexion range of motion, as you can see in this picture here. We want to keep that flexion in the scapular plane, right? So just moving the shoulder up the way that it normally goes to, instead of moving it right in front of you or at the side. This picture at the bottom here shows how our scapula moves in different directions. Scapula is our bone in the back, right? That moves the shoulder. And so it moves in different directions, but we want to keep in mind here not to overdo it with the rotator cuff muscles. All right, so now we move on to the recovery phase here, which is weeks 6 to 12, and that's the next phase. All right, there we go. So the goals here are to achieve normal range of motion and normal scapular muscle strength. So all the muscles that attach to the scapula, that moves that scapula in different directions like we saw in the previous slide, we want to gain that back, right? Because, and I didn't come up with this quote, I didn't come up with this quote, I read it somewhere. Trying to move your shoulder without a stable scapula is like trying to shoot cannons out of a kayak, right? You want that scapula to be your foundation in shoulder range of motion. So scapular stabilizing exercises are going to be extremely important here in the recovery phase, weeks 6 to 12. And then you can slowly start to integrate rotator cuff muscle activation exercises. So moving on from passive range of motion, where your shoulder is being moved, to active assisted range of motion by using things like a pulley or a stick, to then submaximal isometric exercises where you're not lengthening or shortening the length of the muscle, but you're slowly producing force by moving it in different directions. And so what passive range of motion exercise looks like here in this very first picture, with the guy moving his hand up over his head. That's active assisted, right? Because he's using his other hand to get his shoulder into that position. And so I'm not saying we want to try to achieve this much amount of flexion to start with, but that's just an example of what active assisted range of motion exercise looks like. And in this phase of rehab, in the recovery phase, it's all about gaining their range of motion back. Another way to do this is using a dowel or a stick, like this lady is doing here in the picture in the middle. So you have active assisted elevation going over your head, active assisted external rotation, and then active assisted internal rotation. All those movements are important to consider. And then we talked about submaximal isometric exercise. We don't want to go to the max intensity yet because we are still trying to protect that suture site. And so at a submaximal level, producing force, just like he is, where he's pushing into the wall, and internal rotation and external rotation is going to be another way to go about this phase of rehab. Okay, so this is where you slowly start to integrate more strength and range of motion exercises. And finally, we come to the functional phase, which is weeks 12 and beyond. Here, we're trying to achieve normal rotator cuff strength. And we want to also correct the kinetic chain abnormalities. And if returning to sports is on the table, we want to slowly start to incorporate what the movement looks like in our rehab plan, because doing specific exercises for specific movements could result in good outcomes. Not could, it does. It does make a difference. And so how do we do that? I'm looking at the chart here still. I'm looking at this last column. Periscapular muscle strengthening. So yes, we're still working with the scapular muscles, right? We're trying to fire the cannon out of something stronger than a kayak. Rotator cuff strengthening exercises. This is just one way to progress things, going from isometric, which is what we started already, right? And then closed chain, open chain, and then multi-angle functional exercise, plyometric exercise, where we're slowly introducing speed to these movements and power to these movements. Eccentric exercises, working with producing power or producing force as the muscle is lengthening, and setting yourself up for returning to practice, right? With the minimized risk of re-injuring yourself. And if you look at what I wrote down here, these are some of the functional movements that you'll have to master in all planes of motion if you want to set yourself up for success. So pushing is one motion that's important, and that usually requires good scapular stability, scapular mobility, and rotator cuff strength. Pulling is another motion that's important. Carrying, right? And overhead lifting. So this is just one way to categorize movements, and you can fill in the blank with what exercises go with what movement, right? So this is just one way I categorize things in the functional phase of rotator cuff repair surgery rehab. And then we have other ways to advance and progress the exercises. And so altering the speed of the exercise is one way to do it. I want to see a little more control, do it a little slowly, depending on the need and what muscles we're trying to activate, or I want you to do it fast, right? I need you to do these motions fast. Altering the stance, where we're going bilateral stance to asymmetrical stance to unilateral stance with our arms if we're working on the ground, right? So doing push-up with two hands versus asymmetrically unbalanced versus doing it with one hand. And that leads us to the return to sports phase, which is the last phase here. In this phase, you have to consult with an expert in your sport, because what you're going to be doing in this phase, if you've done well up to the point of preparing to return back to your sport, is going to depend. What you do in this phase is going to depend on what the medical professional you're working with has in mind in terms of what needs to happen for you to be able to perform better in your sports. And so I've just included a couple exercises here. The one to the left of the screen here is for baseball pitchers, and how to effectively increase throwing power, throwing strength, and that scapular mobility when you're throwing a ball, right? And then that's going to be vastly different from when I'm working with a lineman in football, for example, because the movements, right, are going to be different. The timing is going to be different, where the rotator cuff tendons are activated and engaged. And so different ideas there. So if you have any questions about this, please feel free to leave it in the comment section down below. I hope that was helpful. And I'm sorry, the last phase here, return to sports phase, I couldn't give a lot of examples of exercises because it really varies depending on what you need. And so it's going to be important to find someone that knows what they're talking about. All right. Thank you guys for watching, and I'll see you guys next time. Bye.